Hi guys, welcome back to my channel. My name is Khadija Tedeshola. In my channel, I talk about everything related to midwifery and women. So today, I'm going to be talking about the difference between delivering having your baby in a Nigeria hospital and having your baby in the UK. What is the difference? Yeah, what is the difference? If you get worried, you'll be like, yeah, the doctors, the nurses, the midwife in Nigeria, they come to other country, and you come to other country as well. They might be the one that will still be taking care of you. So it's not necessarily that. So what is really the problem with the Nigeria healthcare systems and all of that, basically? So in this video, I'm going to be talking about the difference between delivering in an in an in a Nigeria hospital and in an in a UK hospital, like an NHS in England, basically. So, as I always say, the care is the same. Yeah. The care we render is the same. Women is the same everywhere in the world. The women anatomy is basically the same. The care we render is the same, but the way it is being rendered is kind of different. Yeah. The way it is being rendered and the policies is different. There are national policies, there are trust policies, and there are international, there are, World Health Organization policies. In Nigeria, most of the things we do is according to World Health Organization. We don't really have most of our own things, our own way of doing things in Nigeria. In the UK, there's World Health Organization recommendation, there's national recommendation, and there's, you know, trust recommendation. So in essence, there's World Health Organization policies and guidelines, there's NMC policies and guidelines and standard, there's national policies, guidelines and standard, and standard, and there is trust policies. So you have to be aware of all of those things, and the most important one is the one that you follow mostly. You follow all of those things basically, but you make sure you follow your trust policies again, because your trust policies really protect you as regarding the care that you are rendering to your patient, basically. So the trust policy tell you everything you need to do at every stage of delivering care. That's how it is. But in Nigeria, when we have most of the things we do is what WHO say we should do, and sometimes how it is being done in the hospital. Some hospital as well in Nigeria as well. We have some hospital that this is how it is done. This is how it is done. So more like a trust policy kind of in or hospital policies kind of for Nigeria as well. But because it is most of the time not written, most of the time those things are not written in Nigeria. This is what you've been told when you get to the hospital. But in the UK, when you get to the hospital, there are policies. They are where you find those policies. They are already written down, and they are meant to guide you. But in Nigeria, they are not written down. You are being told by, the matrons or the midwives, the senior midwives, or the people that have been working in that hospitals before you get there. They are the one that actually tell you those things, and they are not written down. So that's one thing. So basically, the way we take care of patient as well, of women as well, it kind of slightly different, but basically everything we're doing is the same thing. What makes it different is technology and advancement. This place is that UK is an advanced country, and of course we have an advanced, stuffs that is being used, machines, technologies, research, a lot of those things that they are doing. So that make the standard of care different. For instance, in Nigeria, in most places we still use the peanut tourniquet. So if we want to listen to your baby, we have to do this, all of that. And in some places they have the tourniquet, the one we you know we just the electronic one that just listen to the baby. I think in some rare I have was not really opportune to work in an environment where they use CTG in Nigeria. I could remember as a student in where I was trained, we actually have CTG basically, but we don't really use them, we don't really print them out. The CTG we use then is more like a sonic aid as well. It's more like just listening to the heartbeat as well. We are not printing it out. We'd never printed out during my training period. I don't know if they are printing now, but we don't print out. But in this place, their CTG is working. They print out. They use it to monitor the baby. So the difference between that machine, the CTG machine that they use to monitor your baby, and the one we use to listen to baby in Nigeria is that the one we use to listen, the Sonicate and the Peanut, all of that we listen, just tell us that the baby is alive, basically. And it have range as well. When we count it, it's half range and all of that, and it's usually like graph. Just tell us that this baby is alive. Basically, baby is alive, baby is fine. But the CTG machine tell us this baby is alive and this baby is healthy. This baby is alive, this baby is healthy at this point, but something might change if these things continue this way. We look at it as well at a point, says that everything is fine, there's no problem, there's no cause for alarm, and all of that. And everything, especially when a woman is in labor and you're doing that monitoring, as much as the contractions become more intense, more painful, at any point, if it's starting to affect the baby, we will know as well. But unfortunately, with the listening only, just tell us, okay, oh, this is it, babies, so the heartbeat is within normal range and all of that. At times, the heartbeat may be within normal range, but some other things might be wrong. So it's not only that they look out for. So that is one of the things that makes the care rendering in to care, the way we care for people to be different from Nigeria and to this place. And who is to be blamed with that? It's basically not the healthcare workers' problem for Nigeria, basically. It is the system. So that doesn't mean the nurses, the midwives, the doctors in Nigeria don't really know what they're doing. No. It is the system, it is what is being provided for you that you will use. I can't turn myself to a machine, to use to monitor you. It is what I have that I'm going to use, and that is one of the problem with it, Nigeria. If the healthcare systems can be upgraded, if they can be lots of policies, they can be, some machines, all of those things, the rates, the quality of care rendered will be the same as what is being rendered in Nigeria, in the UK. Another problem is most of those machines actually use electricity. How many hospitals use 24 hours electricity in Nigeria? Yes, we have hospital with 24 hours electricity and all of that. How many people can really afford that? Most of the people from the grassroots level use the PSC. How many PSC have 24 hours light? Some of the PSC does not even have generator. They have to ask the mom that is coming to deliver to bring kerosene, to bring fuel, to fuel the generator. Some don't even have generator and all of that. So that is the problem. I've worked in the community setting in Nigeria as well before, and I know what it is. Where I work, the PSA I work, they only have solar. There is generator, but once they on the generator like this, maybe like it's just for an hour or for 1 hour 30 minutes. But the women that is coming to deliver, they can decided to buy fuel to the generator and all of that. And the people coming to use the grassroots level, the PAC as well, some of them they really need support. They are soliciting for support. They don't have money. They don't do this. So everybody is being incapacitated. The healthcare worker are incapacitated. They can only do what they can do. So some of you that go to the hospital in Nigeria, and when I was working in Nigeria as well, somebody has said to me, if sorry, I'm just trying to speak exactly what the woman said. Tó bá jẹ́ pé abroad nísìn wọn ò ní ṣe bẹ́ẹ̀ fún wọn, òṣì wọn ti pọ̀ jù ń bíbá. Like, I just like, is it not the people that are here, that are working here, that you guys are not appreciating? They are the one that goes abroad as well. So basically, we should delivering in Nigeria and delivering in the UK, the care we really render is the same thing, but just that the equipment, the standard, the advancements, the technology is different, and that is what make the quality of care rendered different. The quality and standard of care rendered different. But the healthcare workers, they are the same, and there's nobody is superior to the other. They only do what they can do and what is available to be used. They can't turn themselves to something to be used to take care of you, basically. So that is that for this episode. If you have any questions, any recommendations, if you want me to talk about um anything, please say that in the comment section. Anything related to women and midwifery. I'm considering talking about things to pack when coming to the hospital to deliver. But I've not really gotten enough, I don't know if I should do that video or not, because I met some people from Nigeria as well, and they were like, they're asking me, are they not going to give me a list of things to buy? I was like, list of things. What exactly are you looking for? Like list of things, they think list of things to buy for the hospital, just as we do in Nigeria, buying soap. So if you want to hear that episode, basically, say that in the comment section. I'll consider doing that video. Thank you so much for watching my videos, and I see you in my next video. Thank you. I love you. Bye. Make sure you watch my video. Make sure you subscribe to my channel.